Welcome, everyone. I am Dr. Andrew Neville. Welcome to our live Q&A here on a couple different platforms. It's good to see you all. So we're going to talk about adrenal fatigue and all the misinformation that there is about that. It's a conversation I have on a pretty regular basis. So we try to do these free kind of live Q&As for everyone because there's so many questions, right? There's so much confusion with regard to this condition and what it's all about. If you're here and you have questions, by all means, put them in the comments. I do have a list of questions that I'm going to go off of. I'm going to do the best I can to get to as many of those as I possibly can. So whether you're new or you've been here before, welcome. A lot of times we need to hear this stuff over and over again. I get that completely. We tend to speak brain fog here at our practice, my team and I. So if you're like most of my patients, right, you've been around the block with this, right? You've tried numerous different things. You've been on the specialist merry-go-round. Maybe you notice a little temporary benefit, but still struggling. And it might be that this issue of adrenal fatigue is really kind of the main underlying piece of the puzzle you're missing. Sometimes it's directly causal and not an ancillary thing. And we'll probably get into that. So welcome. And if you kind of find yourself nodding along and agreeing or having any aha or light bulb moments, and you want help with this, right, to expedite the process, we've got a variety of programs that are available to help you to deal with that. And we try to meet everybody's needs that way. My team is manning the comments, so by all means, if when you do join in, let us know where you're from. We're always curious. Got patients all over the world. I just got off with a patient from Australia, two patients from Australia the other day, yesterday, and then Turkey, and all over. So we're always curious where you're chiming in from. So let us know. Okay, so I have to state this information is for educational purposes only. This content is not intended to substitute for medical advice, diagnosis, or treatment. Always seek the advice of your medical doctor, healthcare provider with any questions you have regarding a medical condition. Now, if you're a current patient of mine, welcome to you as well. You're welcome to submit any questions, but I want you to remember this forum is really for the general public. You all have opportunity to get in front of us, whether it's at our group sessions or one-on-one, to ask those questions. If I have time, we're going to put those at the end. If I have time, we're going to, we'll put those up and we'll address those as well. Okay, so let's see if there's any more housekeeping things. Yeah, so again, in the comments, we're going to be adding links, right? Links. If I make a suggestion or something, they're going to try to put that link in the comments. So keep checking that, no matter which platform you're on. They're going to give access to the Facebook Healing Adrenal Fatigue Holistically group that we have, which is very active and very supportive. Lots of kind of free information, guidance there. Our new Instagram page, the Adrenal Healing Hub, with my coaches posting very real world suggestions and guidance that way. Links to YouTube channels and to setting up a call. We offer a complimentary discovery call with the patient coordinator. So there's lots of ways to get in touch, lots of ways to get more information. Got a good amount of questions, so I'm going to do everything I can to connect all the dots. And I will apologize in advance. It's somewhat rare that I actually get to all the questions, but I'll do the best I can. All right. Let me just confirm with my team that we're good. Okay, so we look good. Forgot to check. Greg says, how do you determine if adrenal fatigue is the actual root cause or not, since symptoms of various syndromes and conditions are similar and some are so bizarre that no one has heard them? Yeah, and that's a phenomenal question, Greg. My patients, to this day, I am occasionally surprised. I think I've heard it all as far as the weird symptoms that my patients develop. And, here and there, I do get surprised still, but I've heard a lot of them. So how do you determine what this looks like. What I try to do is use logic, I suppose. So with this condition, and if you heard me speak about this, you've seen my YouTube channel or some of the, kind of free introductory guides, I'll talk about this bucket, right? This bucket of tolerance for stress. What happens is with a bit of a genetic tendency and enough stress over time to start filling up that bucket, we start noticing some symptoms. And these are early warning signs. Nobody recognizes them as such, but they're early warning signs that the adrenals or this stress response system is in overdrive and there are some problems. And then what happens? Invariably, there's the straw that breaks the camel's back, right? And patients will tell me, ever since that bad infection, right? Lyme, COVID, Epstein-Barr, you name it, right? Ever since that mold exposure, ever since that car accident, ever since that divorce, ever since that death in the family, or ever since that crazy time at work, these are the last straw that really get this physiology stuck. They're triggers. These are merely triggers of this condition. They are the tip of the iceberg, but the iceberg has been building and developing for, years, if not decades. For most of us, it goes back to childhood where we start to get set up from this. We even have research that shows that if you look at the stress of a woman as she's carrying a child, you can predict that stress-related illness that child will have in adulthood, because that's where that stress response system is like a pump that starts to get primed, and it starts to be trigger happy even in utero, right? And then, we're set up from the get-go. Now, you can fix that too. It doesn't matter to me how long this stuff has been going on. You can fix it. You just got to do it the right way, and you got to have the right perception as to what's going on. Now, those triggers, Greg, those are distracting for everybody. They're distracting for patients. They're distracting for doctors, right? Because it's, that's the smoking gun, and we think we have found that thing, right? So let's chase after that. And many do spend years detoxing and cleansing and treating and antibiotics and binding and all this kind of stuff, right? Maybe to make a little temporary improvement, right? If you lower the level a little bit. A lot of my patients, they don't tolerate those treatments though, because their system's been sensitized and it's trigger happy to all those various tools that doctors will use. So how do we know if it's chronic Lyme or mold or whatever, chronic Epstein-Barr? Is we want to use logic. Look back in your history. Look back in your history. Do you have any of the early warning signs, right? Lack of stamina as a kid, low blood sugar issues, maybe some lightheadedness here and there, some anxiety as a child, depression, PMS, right? So some hormone issues. Those are pretty good indicators. Or maybe we get sick too often, right? More often than the average person, or our bowels are a little off, right? All those symptoms are either symptoms or secondary dysfunctions tied to this stress physiology, right? Which gives us evidence, because when you're in fight or flight, let me further explain. When you're in fight or flight with adrenal fatigue, the stress hormones and the exhaust that the stress hormones cause, they're going to cause wear and tear. They're going to cause damage on the body. And at the same time, when you're in stress physiology, you're only activating a couple organs, right? The organs that'll save you from that tiger that must be in front of you. So you're suppressing a bunch of other stuff because you don't want to waste energy on fighting some chronic infection or digesting food or having a bowel movement or hormones and procreation, right? Shut that stuff down, right? And when you do that once in a while, that'll save your life. But if you do it all the time, now you're going to compromise those systems and you're going to develop problems within those systems, of course, right? But trying to fix those systems while your body is purposely suppressing them, it's like trying to push a car when the parking brake is engaged. You get enough behind it, you'll get it to go a little bit, but boy, it's a whole lot more effective to release that brake and let the body kick back in on its own, right? So we want to look at this in the most logical way we can. And I also use logic with regard to Epstein-Barr, these chronic infections, COVID, Lyme. Why did my Epstein-Barr reactivate and my neighbors didn't, right? Or my wife's didn't? The problem was me. The problem was not the Epstein-Barr, right? It was me. All right, so let's ask one more why. Well, what was wrong? Well, my immune system wasn't strong enough to keep it at bay. It's one of those chronic infections that never leaves. Which Lyme leaves, COVID leaves, like your body eradicates those, not herpes family viruses. So my immune system was weak. Well, all right, go ahead, ask one more why. Why? What controls the immune system? This stress physiology, right? We know for a fact that when our body is in stress physiology, it suppresses the immune system, right? Most of us have had a stressful time and we got sick. We were just vulnerable at that time. So the problem is not the Epstein-Barr. The problem is not even the immune system. It's deeper than that. It's what controls the immune system. And this physiology that I'm doing, this seesaw thing, controls our entire physiology. And that's a lot, right? It's everything, ultimately, is what it is. So when doctors look at you and they say, well, you have chronic Lyme, you have mold, you have dysbiosis, you have SIBO, you have, your immune system's off, you've got, and you got these symptoms and things, and you also have adrenal fatigue. Boom, full stop. What? I have adrenal fatigue? Well, isn't adrenal fatigue a broken stress response system? And isn't that system in control of the rest of my physiology? Because that is absolutely true. Okay, I didn't get the hook yet, but I got to move on. So you can fix all this, right? That's the key. You can fix it, but you have to have the right perspective. You have to have the right perspective. Okay, Jane says, why do I get internal vibrations and a feeling of creepy crawlies? Talk about, right, odd symptoms that my patients will have in my feet and legs at times. Okay, so there's a few different reasons, Jane. Part of it is with stress physiology over time and stress hormone over time. That stress hormone floats around. So those hormones float around in the blood, and the blood goes everywhere. So this stress hormone is literally everywhere, and it hits tissue and it binds to tissue. Well, when it hits nerves, it hypersensitizes them. It makes them upregulated, jumpy. So the majority of my patients will have what we call medically paresthesias, weird numbness, tingling, burning, itching, pain sometimes, random, transient. I mean, it's kind of all over. Now, can I definitively say that symptom is associated with adrenal fatigue? No. Could it be something else? Maybe. The way you want to figure that out is look at the all of the symptoms together, right? So on my website, I've got a system assessment tool. My team will put that link in the comments. And it'll take you 4 or 5 minutes, right? Answer these questions, and it'll talk about the likelihood of whether or not you have adrenal issues and give you some resources that way as well. So it might be likely if you're here, you resonate with some of the symptoms, so maybe it's likely, but that assessment tool is a pretty good place to start. Okay, good luck. Debbie says, can I increase my cortisol outside of hydrocortisone? 100%. So I'm not a fan of hydrocortisone used chronically, right? Used chronically. So hydrocortisone is just a synthetic version of cortisol, right? It's a steroid. All steroids are mimics of cortisol. And all of my patients, right, who have cortisol issues will go into their doctor, and their doctor will diagnose them with some condition that they use steroids for. Itises, bursitis, tendinitis, uveitis, arthritis, all kinds of itises and inflammatory stuff. So they're like, just take some prednisone, take some hydrocortisone. Again, logic tells me if this patient's body makes a substance that is identical to this pharmaceutical that I'm giving them, maybe there's a problem with that gland that's supposed to be producing that stuff. Yeah, they don't really go there. So I don't like using hydrocortisone to treat cortisol issues, because when you use hydrocortisone, the HPA axis gets shut down. The brain thinks, well, there's plenty of cortisol here. I don't have to trigger the hypothalamus doesn't have to trigger the pituitary to trigger the adrenal gland to release cortisol. So they call that gland suppression. So you suppress the adrenal gland's ability to produce that hormone. So replacing cortisol is not as easy as replacing thyroid, because cortisol is probably the most dynamic, nuanced hormone that's out there. It's rhythmic. It creates your circadian rhythm, right? So it starts up nice and high in the morning, gets us up and ready for the day, and then it goes down, right? Little by little by little. If you suppress it with hydrocortisone, now you got to try to dose it and be like, well, how much do I need here? What about this? And within that curve, there are 300 to 500 microsurges of cortisol throughout the day. The body is constantly using this physiology, adjusting. What do you think? We need a little more, a little less, a little more, all day long. You lose all of that dynamic responsiveness when you use hydrocortisone. So I'm pretty well against it, except in the most extreme cases. Rare have I ever done that. Can you use it? Yeah, you can help to increase cortisol. The first thing is stop burning through it. Get this physiology to shift, right? And there's lots of different ways to do that, and we'll probably talk about some of them. Where I start that conversation though is with the foundational work that we do in each one of my programs, right? I've got a coach-driven program. I got a program that I still run. And I even have a core program that is a self-paced, self-led program. They all start with that core program, which is really the foundation of what we do. How do we figure out all the reasons we're filling up our bucket and we can't empty it? How do we poke holes in the bucket? How do we scoop something out of the bucket to create space in the bucket? So now we have tolerance for our life and we can loosen up this physiology and we can stop the wear and tear and turn on the healing and repair, because that's what fixes people. It's all based on that core program. Now, we have revamped that core program this year. You might have heard me talk about it. It is so robust with information, education, knowledge, tools, guidance. It is the basis of what I do. So just so you know, and they'll post a link. My team will post a link in the to get more information about that core program. But that core program is $497. But until Labor Day, which is coming up, until Labor Day, we're offering it now for $297 to get it in front of more people, because it is the core. It is the foundation. And with that program, look at the testimonials, look at the reviews. People have just done that program. They're like, yeah, I'm shifting. I'm feeling better, right? And while you're on this call, or right now, right during this call, there's another $30 off, I think is what they're telling me. So going back to hydrocortisone. So if we're using hydrocortisone, even if we're using cortisol support, that's way up here as far as, away from the foundational work. The foundational work is really the key, because any work up here on this hierarchy, it's going to be a little more temporary. I support cortisol with pregnenolone, licorice root, adrenal cortex extract. You just need testing and you got to know how to do it. Okay, Joanna says, with adrenal fatigue, is it common to wake up feeling shaky and weak? And as the day goes on, you feel your best at 6 p.m., even though when you tested 3 months ago, you had high AM cortisol? Yeah. Okay, so Joanna, I was mentioning, right, the cortisol rhythm. Now, cortisol it's the only adrenal hormone that we can measure effectively. Can't measure adrenaline very well. We can't measure the pituitary hormone in that cascade, ACTH. We can't really measure the hypothalamic, CRH. And there's other stress hormones. We can measure cortisol, but it's way more than an issue with just cortisol. So that's really the challenge. With this condition over time, the stress response system itself, which is, again, more than just the hormones ending in adrenals and cortisol. It's more than the hormones. It's more than the nerves. It's also this limbic system in the brain. That system works together. That system gets trigger happy. So the limbic system starts to overperceive its environment as dangerous. We make mountains out of molehills. That's what I talk about, right? So it's a minor stress. We have a major response. So in the morning, there's something called the cortisol awakening response, which is why we wake up. That is the first to do or stress of the day. And a lot of us overshoot the mark, right? We overshoot the mark. And, now we're stuck in fight or flight. We may or may not be dumping adrenaline. That is going to mess with our energy. You'd think high cortisol and high adrenaline would give us great energy. It doesn't. I have patients in the early stages of this with high cortisol, and they are absolutely exhausted because it takes a lot of energy in the body to run away from a tiger, or you might fight. I'm a runner. But if you want to fight, you can fight. So you're going to fight the tiger consistently, right? For how long? How long have we been fighting or running from this tiger, right? Not just a couple minutes. It's days, it's weeks, it's years that we've been in that space. That is debilitating to your cellular energy production. Like how long can a zebra run from that tiger? I mean, 30 seconds, 60 seconds, and then it's got to go curl up under a tree and rest and heal and join the herd again. So energy is not directly indicative of cortisol, right? And these kinds of concepts and all this kind of information this is stuff that my team and I teach on a regular basis in our programs. And there's a lot, and it helps. I found it helps me to know answers, right? I like to know the answers of whatever I can. And some are a little elusive, but we know most of the answers with regard to this. And this is what we talk about day in and day out. And oftentimes, especially because of the brain fog that most of us have, we need to hear this stuff again and again and again before it starts to click. It's like when I read my predecessor, Dr. Posnecker's book, the Chronic Fatigue Unmasked book, or Unveiled now. I've read that book probably 10 different times. And I swear I got something different out of it every time I read it, right? When the student is ready, the teacher will come. I wasn't ready to hear some of this stuff. So we have to there's this progression of understanding and knowledge that we want to build upon. That's why the programs are 3 months or 6 months. I'm usually in touch with patients longer than that. It just takes that long. And that perspective, again, it's super important, right? Because this perspective helps us with the expectations. We've all been raised in a paradigm of one drug for one disease, right? It's the germ theory. You have a bacteria, take an antibacterial. You have a virus, take an antivirus. You have anxiety, take an anti-anxiety. Depression, take an anti. It doesn't work that way. It might work for the germ theory pretty well, but it does not work effectively for these conditions, because even if you're lucky enough to pick the right drug, you might cover up the symptom, but you haven't fixed the underlying problem. Your body's still stuck in fight or flight, which means it's like putting a little piece of tape over the check engine light in your car. You might not see it. You might not see the warning sign, but you haven't fixed the problem, and it's going to get worse over time. So, yeah, again, if you're questioning or you have questions about that, you can always, check out the symptom assessment tool, reach out for a call if you have further questions. But, with adrenal fatigue, when we look at this in this way, the way I'm describing it, it's fairly obvious. And I know people try to connect the symptoms of adrenal fatigue with other conditions. They're correlations, they're not causation. So they'll try to connect a bunch of Lyme symptoms to a bunch of adrenal symptoms and say, oh, you have two. I'm like, no, you have adrenal fatigue, which is setting you up for the Lyme, which is also setting you up for all these symptoms. That is what we have to fix. Okay. Sarah says, do I ever not need Celtic sea salt anymore? How would I know? If cell hydration is so important, it seems I could take it indefinitely. So salt's important, right? So Celtic sea salt tends to be what I recommend, some kind of unrefined sea salt. And so sea salt provides sodium. We need sodium. It's one of the most basic minerals in the body, right? Sodium is critical to drive these little sodium potassium pumps. There's hundreds and thousands in every cell, and there's 50 trillion cells. So you take a little salt, that salt is like poof, it is everywhere, and it is essential for every function in the body. Well, your sodium is controlled by your adrenals. It's a different hormone. It's called aldosterone. Not that easy to test for aldosterone, but it tends to run with cortisol. So my patients tend to need salt. We need salt in general, right? There's an RDA, which is, I don't know, you don't want to go by that, but there's a recommended amount of sodium that we're supposed to get in our diet in general, right? People with adrenal problems tend to be at an increased need of that sodium because their aldosterone's not doing that job. Now, how much sodium versus potassium you need, it depends on the stage of this condition you're in. Early stage, people need more potassium, less sodium. Later stage, it flips, more sodium, less potassium. Middle stage is where it gets interesting. So most of my patients need a fair amount of salt for a while. We tend to be challenged with when we sweat or when it's hot out, we have intolerance. So we just need more salt. We use symptoms like frequent urination that a lot of patients have. You need more salt. Lightheadedness, you need more salt. Those symptoms are annoying, but what that means at a cellular level is that you're chronically dehydrated. And when cells are dehydrated, they don't work. they're not going to detox. They're going to be pro-inflammatory. They're not going to do what they need to do. So we've got to support that until your adrenals can do it. So ultimately, Sarah, when your adrenals balance back out and your adrenals heal, they can manage your sodium intake and your sodium needs based on a normal diet. And you don't need heroic amounts of salt anymore. All right. Sherry says, I have SIBO and low stomach acid. Every winter we go to Mexico, but I always get E. coli or salmonella or something from the food. What can I do to prevent that from happening? So stress physiology, right? Stress physiology, suppressed digestion, starts at the vagus nerve, right? That vagus nerve is the autonomic nervous system. It's the main nerve that runs your gut top to bottom. And it runs peristaltic movement. It runs the cells that produce acid. It turns on the pancreas, the gallbladder, the liver. It's all connected to that vagus nerve, which gets shut down if there's a tiger in front of us, proverbial tiger. You name your own tiger. So when that vagus nerve is shut down, we have low stomach acid, and then, it leads to all the IBS, the SIBO, the dysbiosis, candida, food allergies, malabsorption, leaky gut, all that kind of stuff that all my patients have, which I don't chase after. I don't chase after it. I had a woman come in. She had been treated in the past year 4 times for SIBO. I'm like, you think there might be something underlying that? Why do you have to keep treating for this thing? Right? So I said, look, I'm going to ignore your SIBO. I'm going to fix this underlying problem. And we never had to deal with the SIBO again. Your body knows how to do this stuff. So hydrochloric acid, stomach acid, is there for a couple different reasons. The first thing is it sterilizes everything. Right? Everything. It kills everything because it's food, right? And there's all kinds of weird stuff in food. Like you're introducing the outside environment to your body. You need a bunch of acid to squash all that stuff. It also liquefies your food and then allows food to transition, stimulates the pancreas, does all that stuff. So, the main way I look at supporting that side of things, I guess, would be, considering a trial of hydrochloric acid. You can use it supplementally. It's available, betaine HCl. Take a certain amount and do it that way, and maybe consider a boatload of probiotics would probably be a good recommendation. Okay, Fabrizio says, if you have adrenal fatigue and high blood pressure, should you use sea salt? All right. So most patients with adrenal problems in the beginning, in the early stages, tend to have lower blood pressure. And they tend to have lower blood pressure because of this sodium thing, right? In the body, water follows salt. It's osmosis, right? So if the adrenals are weak and you can't hold on to salt, you can't hold on to water, blood volume is mostly water, so blood volume tends to go down, right? So we see lightheadedness and issues like that. Incredibly common. Well, over the years, you can couple that with a bunch of stress hormone, and stress hormone, they're all vasoconstrictors. So they constrict our blood vessels on purpose. And again, if you do that in a normal way, that's okay. You want to do that. But if you do that excessively, the blood vessels start to tighten up and they don't relax as well. And now the heart starts to pump against a narrower tube, and then the blood pressure can start to increase. This kind of salt in general generally doesn't raise blood pressure. In general, salt-sensitive hypertension is actually much more rare than everybody talks about. As soon as you have high blood pressure, they take everybody off of salt. Salt only affects about 15% of the people. 15%. And when it raises blood pressure, it's anywhere from 4 to 6 millimeters mercury. 4 to 6 points systolic. It's not that much. It's not that much. So when we do it, right, if I have a patient with high blood pressure and they also have adrenal problems and I know they need some sodium, I need to get some in, we go slow, right? We go slow, we listen to the body. And in my programs, my coaches are taught, and what I've learned is we have to make one change at a time. That's the key. You want to make one change at a time so you know cause and effect. Be conservative with it, makes sense. You shouldn't have any side effects from anything that we do. And you want to just do things incrementally and go with caution. You need guidance, right? You need guidance. You should have testing, right? Not conventional testing, but you have testing for your adrenals, which goes towards saliva testing to look at, cortisols and what stage your needs might be different. Whatever you do, go slow. That's the key. Now, welcome everybody. I should say again, let us know where you're from. It's good to have you here. If you have any questions, throw them into the comments. My team is there manning the comments, doing an incredible job. Marlena says, I have a 2.4 centimeter mass on my adrenal gland. The doctor says it's not cancerous and there's no reason to remove it. What do you think? Well, Marlena, I'm not your doctor, but the more pictures we take inside our bodies, the more we see these random cysts and growths and all kinds of interesting things, the vast majority of which are benign. So chances are, with conventional medicine, they're kind of doing CYA medicine, right? So chances are, if they said it's not a cancerous lesion, and it probably isn't, right? It probably isn't. And, I don't generally like to do surgery if I don't have to. What Hans Selye found, so Hans Selye coined the term stress and or at least brought it into the public domain. And what he found was that when he stressed his rats, no matter how he stressed his rats, toxins, overexercise them, restraint stress, viruses, things like that, little surgeries, when he stressed his rats, they all got sick the same way. They all developed thymus atrophy. So thymus gland is crucial for your immune system. Thymus was suppressed. The adrenals enlarged, and ulcers. They developed ulcers because of all this same physiology. So to me, when, these masses and growths, because we see them on the thyroid quite a bit as well, these masses and growths will develop when the body is trying to do one thing, but something else is counteracting it, right? So if the adrenals are weak, but the limbic system is saying, hey, we need cortisol. It's like you're whipping a tired horse. It's like, I'm trying. So it swells. And, could that potentially be the underlying reason? We don't know. But if, so if you're not going to do anything about it, that's one thing. But if you still have adrenal problems, right, then that's a whole nother thing, right? You want to go to the website and look at the symptom picture, right? If it walks like a duck, quacks like a duck, looks like a duck, it's a duck. So look at the symptom assessment, look at those symptoms, and 4 or 5 minutes, it'll spit out likelihood you have adrenal problems that you definitely want to fix. And the reason I say that is because this physiology is also the physiology of aging, right? Of inflammation. So when you balance this physiology back out, right? Because remember when we're in stress physiology, we're causing excess wear and tear while we're suppressing the healing and repair side of our physiology. That is not a good equation for good health and well-being moving forward. And when we fix this physiology, now you put your body in an anti-inflammatory state, in an anti-cancer state, in an anti-aging state. This is powerful. It is, I'm blessed with what I'm able to do with patients and how we're able to balance this physiology, help people understand how this condition works, but also how health works, right? How the body works, right? What are we supposed to eat and when? How are we supposed to do that? What about mindset? What about thinking? What about my programming? I'm type A, I'm perfectionist. How do I get rid of that? We're going to talk about that, right? But I'm glass half empty. How do I think glass half? We'll talk about that. What is this vagus nerve? What does that mean? Why can't I wear rubber soles on my shoes and never touch the earth so that I can ground, right? Like we talk about all this stuff. And these things, these habits, these behaviors are crucial, not just to get well, but to stay well. And that's what we teach. Okay, Lorena says, what does AM cortisol of 8.5 means if your symptoms align more with Cushing's? I can't tell you that, Lorena. I don't know the blood cortisol, salivary cortisol. Again, symptom assessment tool, that's where you want to go to. You want to look at it. The difference between blood cortisol levels and salivary or urinary cortisol levels, there's a company doing urine spot tests, which is fine, is the difference between measuring all your cortisol and free cortisol. All your cortisol means protein-bound cortisol as well as free cortisol. Most cortisol, most hormones in general, they're bound to proteins and they're inactive. 95% of your cortisol is bound to a protein. It's not doing a darn thing. It's just floating around ready to be used. It's the free cortisol we want. So that free cortisol is really crucial because that's what's active in the body. And the HPA axis will down-regulate. It'll change the receptivity. It'll change the sensitivity of the cells. It'll change the release of the cortisol from its bound protein. So you have to kind of read between the lines. That's why we need testing. And again, you need the symptom assessment tool. I mean, if you have symptoms of Cushing's, then you've got adrenal issues. And the name adrenal fatigue is not a good name for this condition. I didn't pick it. I don't like it. I'd call it an adrenal dysfunction, right? If anybody knew what an adrenal gland was, but it's not even just a problem with your adrenals. And this is kind of the key, right? It's the whole HPA axis. So it's all those hormones. It's the autonomic nervous system. And I tease these apart because to look at them and look at symptoms and treatment, they're a little different, right? But you can't, physiologically, they work together. You can't affect one side without the other. And it's all controlled by this limbic system in the brain. You can't just try to treat the adrenals and fix all that other stuff. It won't happen. You can't just try to fix the nerves either. This is what doctors will do. Oh, you have nervous system dysregulation. Okay, yeah, but not only. Some doctors will focus on the adrenals. Oh, we got to fix your adrenals. Here, take some vitamin C and some ashwagandha. Ugh. Yes, you have adrenal problems, but not only. Some doctors even take pictures of the brain, look at the limbic system, like, oh, look, your amygdala is all lit up. You've got limbic system dysregulation. Sure, but not only. It's much more effective when you look at that system as a whole, because it works as a system. It does. It works as a system. It's well documented, but it's documented up in PhD level research. None of that trickles down, unfortunately. So, okay. Marinella, could I still suffer from Addison's disease if my cortisol levels are low, but I suffer from weight gain as opposed to weight loss? Okay, so we just heard about Cushing's and we heard about Addison's. Cushing's disease, these are two very opposite ends of a spectrum. Cushing disease is most notably a pituitary tumor where the pituitary keeps stimulating the adrenals to release too much cortisol. That's bad. That is so incredibly rare. I think it's like 1 in 500,000. Addison's disease is the exact opposite, complete failure. Usually autoimmune, not always, usually autoimmune. The adrenals have completely failed. You can't create any cortisol. Those patients need, they need supplemental hydrocortisone and some other things. I've got patients with Addison's disease in my practice and adrenal insufficiency. To an endocrinologist, if you don't have Addison's and you don't have Cushing's disease, you don't have an adrenal problem. They won't let you. What? Even Thomas Addison himself, who the disease was named after, he didn't name it after himself. Somebody named it after him. He said, it makes sense to think that if you can have this complete failure, that a milder version of this condition exists. And it does. It does. And it does for the other glands, right? Like, let's think about, okay, here's logic again. This is the fourth time. Logic, common sense. You got three main hormone producing glands in the periphery. You got your thyroid, your reproductive hormones, right? So ovaries, and you got your adrenals. They'll let you have a thyroid problem short of complete failure. They'll let you have a problem with your ovaries short of complete failure, but not your adrenals. If your adrenals are working at all, they're perfect. What? It just doesn't hold water. This stuff makes me nuts. So could you have Addison's disease? I mean, you can go to your endocrinologist. They can prove you do or do not have Addison's disease, which, if you're concerned, you can. Again, ridiculously rare, 1 in 500,000 people. So rare. This adrenal fatigue thing, not rare at all. So once you rule out Addison's, you come back and get it tested and fix fix the actual problem. Okay, Patty says, ever since I have adrenal fatigue, I have had lots of food cravings, especially sweets. What do you recommend to curb my cravings? Right. So people with adrenal problems, we like sugar. Love sugar. Myself included. I would convince myself, there's all these revelations as I think about my childhood, right? I used to convince myself I like to have tea with my mother, like black tea. But when she wasn't looking, you should see how much sugar I would pour in that tea. You could stand the spoon up in that teacup with the amount of sugar I put in that stuff. So we all like sugar. We're driven towards sugar because cortisol controls sugar. And if your cortisol's off, you're going to have problems controlling your sugar. Don't eat it. So what everybody gets in the programs that we use, there's even introduction in the core program, is an introduction to the hypoglycemic diet. Hypoglycemic diet. Small, frequent meals, more protein and fat, low sugar and carb. You do those accurately enough for your condition, the sugar cravings will gradually go away. Now, most patients at that point, they will roll their eyes at me, and I could see in their brain, they're thinking, he doesn't know, he doesn't understand my sugar craving. I can go on some sugar-seeking behavior that'll make your hair stand on it. No, I do know. I do know. And I have seen when we do those things right, those sugar cravings incrementally will balance back out. That's it. And then you fix the adrenals, and then you don't have to eat that way as tightly. We shouldn't eat sugar. Sugar's bad for us. It'll kill us all. I mean, it's so horrible. All these simple sugars, they shouldn't even be allowed in the supermarket. They're that bad, right? I mean, that's just the reality. That's just the reality. But what can you do? They make money, though. They make money. Sean says, is thinking of one thing while meditating supposed to help your mind from being all over the place? Yeah, I suppose that's true. So my patients will invariably be called upon to do some form of a relaxation exercise. Could be a deep breathing exercise, could be visualization, guided imagery, could be repetitive prayer, could be meditation, doesn't matter. But the concept is, yeah, you want to be quiet, comfortable, you want to focus your mind on one thing, whatever it is, doesn't matter. Your limbic system doesn't care what you're actually focusing on. Could be a word, could be a phrase, could be an image, could be a picture, could be your breath, whatever. Limbic system doesn't care. You're going to focus on this one thing, which nobody can do. Nobody. So you're going to focus on some one thing. Your mind's going to go away. Just bring it back. So your mind's still going to go all over the place, and that's okay. Just don't let it, right? When you notice you're thinking about something else for 5 minutes, just bring it back. No judgment. You still get the benefit. Ultimately, the benefit of this, Sean, is that it rewires the limbic system. Now, it's busy. In the beginning, when people are learning this, it's easier to think of more, put more in your brain. Still one thing, but more, like a picture or an image or a guided imagery, progressive muscle relaxation. But even when you're doing that, your mind's going to dance away. Just bring it back. That's it. Over time, it slows down a little bit. Over time. And it's what I do with my patients, what my team does, right, in the coach program with their patients, is what we do is we figure out what each individual person's therapeutic puzzle looks like. Not this ancillary stuff. We're not chasing symptoms. We're not working on secondary dysfunctions. We're dealing with this broken stress response system. We want to fix that. And there's this puzzle. There's lifestyle factors. There's mindset. There's relaxation exercise. There's diet. There's salt. There's all kinds of puzzle pieces. And everybody's puzzle is different. And this is what we've gotten good at. Figuring out, because there's even some common basic puzzle pieces that I just mentioned. But even those, different shape, different size, different orientation. So this is how we work with patients one-on-one to help them incrementally figure out what those puzzle pieces look like. Let's see what's missing. Like, why isn't it shifting as fast as it should, right? Or how do we expedite this process? It's incremental recovery where symptoms gradually decrease and we incrementally get better. We're always trying to move it faster, and everybody's puzzle's a little different. We've gotten pretty good at doing those puzzles. We've been doing it for years. We've done it for thousands of patients. And I can tell you, if you're curious about what we do, we offer the most personalized guidance and support of any of these programs or any of these other practices that I've seen. Because remember, I still field patients on a daily basis. I know what they've tried. I know who they've tried. I know which experts they tried. I know which world famous clinic they were at. And they still end up in front of me because they haven't had the guidance and the perception and the understanding and then the support to get them back on their feet. It's okay to need support. It is. Okay. Julie says, I battle migraines along with adrenal insufficiency. Adrenal insufficiency may be contributing to those migraines. Julie, I've come to find out that licorice root and pregnenolone exacerbate migraine activity. Is there any hope to help the adrenals with other substances? Okay, so, migraines are so incredibly multifactorial. I'm not sure who said, or if it's your experience, that licorice root and pregnenolone will exacerbate migraine activity, because they don't always. In somebody with migraines, anything can exacerbate a migraine, trigger a migraine. You can eat a food you're sensitive to and there's a migraine. You can get stressed out and there's a migraine. You can have your hormones change and there's a migraine, right? There are numerous triggers. So I wouldn't throw out licorice and pregnenolone like across the board. And what you have to remember, like, we have this new fancy AI technology, which is wonderful, right? And it's good, but you got to remember what they're sourcing. They're sourcing conventional, they're sourcing the stuff that's out there. Not everything is out there. And certainly a lot of the stuff that's out there is garbage and inaccurate and is coming from somebody documenting something whose paradigm is like they got blinders on. Like, this is my paradigm. I'm going to write this. With adrenal fatigue, somebody wrote an article about it 20 years ago, and there's about, 10,000 different sites, and they just republish the same stupid article that doesn't get anybody better. So we have to think outside the box with regard to this stuff. There's always hope, right? So there is literally always hope with regard to this. Julie, do not give up, and don't throw out the licorice and pregnenolone either. Licorice and pregnenolone I'll use, but I don't use them in everybody. You got to have testing, you got to understand. So, okay. Adriana says, do you treat mast cell activation, which is what I'm being treated for at the present time? I also have adrenal fatigue. No. You have mast cell activation because you have adrenal fatigue. So I also have adrenal fatigue, histamine issues, etc. So mast cell activation, that's histamine issues. Is this something you can treat or are familiar with? 100%, I'm familiar with it. Okay, so we're going to think logically here, Adriana. Mast cell activation. So the mast cells are little cells in the immune system. They are not the only, but the primary releaser of histamine, right? And histamine is kind of involved in our allergic response. With stress physiology, I said earlier that stress physiology hits the immune system and makes us susceptible to viruses, right? Lyme, COVID, Epstein-Barr in my case, in a lot of cases, all those kinds of things. Well, what happens in the immune system is it actually shifts. So this one side gets suppressed, called the Th1 side for T helper cells. That side tends to get suppressed, and there's another side of the immune system that gets overactivated. It's called Th2. The Th2 side is the side responsible for antibodies, and they should be in balance. We need them both working together. Neither one is bad or good. The Th2 side produces antibodies. That side gets overactive, so now we increase antibody production and increase the potential to make mistakes and create allergy or reactivity, which is going to be involved in histamine. So underlying the histamine issues and the mast cell activation is going to be this Th1 to Th2 shift that happens, and that is caused by the adrenal fatigue, ultimately the broken stress response physiology. So you can take all the mast cell stabilizers, you can take all the vitamin C, quercetin, luteolin, DAO enzymes, you can take all this stuff, right? Which is fine, and I'll use those things. I pretty much assume histamine issues in the majority of my patients. But until we fix this underlying causal mechanism, right, you're going to have to take them forever if you even make any headway with the mast cell, right? Low histamine diets and all that stuff. So am I familiar? Yes. Got to dig deeper. And if you have more questions about that, feel free. So for you, for anybody, we offer a complimentary call with our patient coordinator where you can ask questions, figure out if we're a fit. Go to my YouTube channel. I talk about this stuff all over YouTube, right, to get a little more understanding about what's going on. Okay? Reach out. So absolutely, this is not, I also have adrenal fatigue. It really isn't. It's causal. Now you eat a food that you react to. Now that's an added stress. That goes in the bucket. So it is circular. And I'm not saying that Lyme and COVID and allergies and histamine, like I'm not saying they aren't in the bucket. They do contribute to adrenal fatigue. But again, why do you have allergies in the first place? Why does this person clear Lyme and you can't? Why does this person clear COVID and you can't? Epstein-Barr, so we just want to think a little deeper. Okay. Eva says, is not feeling rested ever, even though he slept 8 hours, a symptom of adrenal fatigue? Maybe. Is it sometimes mixed diagnosis, sleep apnea, or could it be both? Not obese, weak, carnivore. So, I mean, generally, if you're diagnosed with sleep apnea, you have sleep apnea, right? You have wakings, and then they'll look at oxygen, things like that. So that's real. There's a bunch of different causes for that. Could that be adrenal stuff? Absolutely. Fatigue is a hallmark of the symptomatology of adrenal problems, which is at the underlying, it's either a strong contributor or the cause even of chronic fatigue syndrome. Fibromyalgia, ME, right? Myalgic encephalitis. It is directly related to this. The challenge with this condition is it's not well understood. And what I found with patients in those populations is they can kind of shut down as far as what is all connected to this. Because as soon as I mention the word stress, they roll their eyes. They're like, you're going to tell me stress is causing my debilitating symptoms, my disabling symptoms? And my answer is yes. Yes. The misunderstanding, though, is what stress actually is. And again, this is well documented in PhD level literature, well documented. A guy by the name of George Crucis wrote an article, research article, this is years ago, Stress and Disorders of the Stress Response System. It is powerful, has all this information, and it's excellent. So I don't know if I answered the question. The answer is yes. Symptom assessment tool, reach out, call. Amaraj says, should I be eating in the middle of the night to be able to sleep? I wake up every 2 hours throughout the night. When I eat, then I can go back to sleep. Well, if you eat, then you can go back to sleep. Yes, you want to eat. It's fine. Small meals, right? That makes sense to do until your adrenals can manage your blood sugar. Everybody's blood sugar drops overnight. When people with adrenal fatigue, when our blood sugar drops, it's a minor stress, but we generate a major response. Now we're wide awake. Most people sleep right through that mechanism. The better your diet throughout the day, hypoglycemic diet, the better it's stabilized at night as well. So, for what it's worth. Dr. Neville, Fabrizio, do you recommend a period of complete rest to begin the healing process? Thanks. Fabrizio, I recommend rest at the beginning, middle, and end of the program. Now, I will tell people that rest alone can heal you. Believe it or not. Right? If I could put you in a cabin in the woods here on our property, just feed you good food and not stress you out and keep you out of your head, rest alone would heal you over time. Now, it would take a long time for that. So to me, rest is a piece of the puzzle, but it's an important piece. Rest as much as possible. I have never had anybody overdose on rest. So too is pacing, but rest. Okay, Jill says, if there was an electrolyte drink that you would recommend, what would it be? I use this and that. Both have decent amounts of that. Okay. So for years, I have looked for a decent electrolyte drink, and I have not found one until I found Element, which is LMNT, which is decent because of the ratio between sodium and potassium. Most patients with adrenal problems need way more sodium than they need potassium. So this drink has 1,000 sodium, 200 potassium as opposed to the other one, which is, it's just a 50%, 800 and 400. So it depends on the patient, but I tend to lean much more for the sodium. And in fact, I don't use Element all the time. I just use Celtic sea salt in water, right? Quarter teaspoon gives us 500 milligrams of sodium, and then minuscule doses. Usually the potassium takes care of itself. To know how much salt, we got to look at those symptoms I talked about earlier in the hour, and then we got to look at testing as well. Okay. Deb says, do you work with, my eyes get blurry over an hour doing this. Do you work with diagnosed adrenal insufficiency? I do, Deb. So I mentioned earlier, thank you for clarifying. So I mentioned earlier, Addison's disease, Cushing's disease. Adrenal insufficiency is an official ICD-10 diagnosis, just short of Addison's disease. So you don't have complete failure, but it is a diagnosable condition. Now, if we put everybody on a bell curve here, optimal adrenal function is kind of way in here, right? So if you have adrenal insufficiency, it's pretty bad. Most of my patients will not reach that diagnosis, but they are still significantly disabled even without that diagnosis. Anyway, I've got patients with adrenal insufficiency, Addison's disease in my practice because there's way more to it. Again, we got to look at the rest of the stress response system. And even from an adrenal perspective, they give patients cortisol. Maybe they give them fludrocortisone, right, to replace the aldosterone. But there's a ton of other support that you can utilize, even from an adrenal hormone perspective. DHEA, rarely have I had a patient who has adrenal insufficiency or Addison's where doctors put them on DHEA. DHEA is so incredibly important. It's the most abundant hormone in our body. Why? Just because we don't understand exactly how it works doesn't mean it's not important. The body's making it, and it's making a lot of it. It's probably doing something. I don't know. Logic. Okay. Victoria says, I have adrenal insufficiency. Look at that. I have adrenal insufficiency. I don't know if I'm taking enough steroids. Is there a test that I can take that would determine how much steroids I need? I am almost always feeling fatigued and tired. Yeah, so fatigued and tired, I'm not sure which question is last, above or below. So if you're fatigued and tired, it means something's going on, right? Something's not being supported. And could it be steroid? Yeah, it could be. It could be. I mean, even blood levels of that will get you the information. Again, the problem is you're just replacing, the adrenals produce so many different hormones and you're just replacing one. So there's more to it, right? There's more to it. Just kind of going back to what I said with regard to Deb, Victoria, there's a lot there, right? There's a lot there. So there's a lot that needs to be treated. And in patients, so again, I've mentioned a couple programs that I have, right? I have patients that can still work with me for a while yet. Then I've got a coach-driven program for patients with Addison's or adrenal insufficiency. You need to work with me because we got to manage, when I got to manage meds, when I got to manage, talk about steroids and testing and things like that, you need to talk to me. Again, reach out. If you have questions, reach out to the patient coordinator. It's a complimentary call. They can guide you on that conversation. Okay. Carol says, what are your thoughts on taking holy basil supplements to bring down mid-morning cortisol? Will that give me more or less energy? I don't use holy basil. I don't use adaptogens very much at all in my practice because a lot of times they overstimulate people. And I don't want anybody to be overstimulated because when you're overstimulated, you're kind of jacking up your cortisol and or adrenaline. And it's like using a stimulant. Like I can just give you a bunch of coffee and you probably have more energy. You would crash afterwards. If we get energy from a stimulant, that energy is not yours, right? If you get energy from a pill, it's coming from the pill. It's not coming from you. So what we do is I use all these supports. I do all the things that we do to shift this physiology to improve your body's ability to create energy. And it's way more than a problem with just cortisol. There's mitochondrial problems, all this stuff. So we got to fix all that. We want to ramp up support, make sure this physiology is shifting, maintain it as long as we need to, with the idea that let's get you off this support. Then you can get back on your feet, get your life back, and then stay away from as many doctors as you can, including me. That's the goal. I'm not a fan of creating customers out of patients. I want to understand what's going on. I want to fix it. I want to help you understand how to do it on your own, and then go live your life. Go live your life. You don't need candida cleanse after candida cleanse or detox after detox. You shouldn't need these supplements forever. Do I use them? Yes, but I use them to fix the problem, not treat people. You got to fix it. And again, the supplements are just that. The supplements are supplementary. Everybody wants a supplement. It's easy. I get it. The supplements are supplementary to all this core work, foundational work that you can start with that will help. It will help. This core program that I've been talking about is the foundation of my work. It's based on all of the research, not the research, but all the guidance and all the questions I've answered. Everything that I've told patients who used to come and sit in front of me and tell me about their symptoms and tell me about their problems, all the guidance, advice, knowledge, education, understanding, support, cheerleading, all of that stuff I've documented. I've written it out. I have recorded videos, especially for the brain fog people. There's tools, there's tips, there's techniques. What's important? What can I let go of? It is all in that program. And again, through Labor Day is at a reduced rate, $297. And if you do it now, there's $30 off that they just that they said for this hour, because the price goes up to $497. It's at the lowest price that it'll be right now, and it'll help. It'll help if that's all you can do. If that's all the resources you have, I would strongly advise you to do those things, because if you do those things, if you follow that advice, you will improve. Now, are the programs with me and with my coaches better? Of course they are, right? But this is self-led. It's self-paced with you in mind, not to overwhelm. You go at your own pace. I know you're easily overwhelmed. I know your bucket's full. Take your time, right? And it's always there, right? Lifelong. Read it again. Do it again, just like I read Dr. P's book 10 times, right? Do it 10 times, whatever you need to get through this. But this truly is the foundation. I can't be more proud of what we produce there. Okay, I'm a couple minutes over time. Appreciate your time. Good luck. Keep at it, right? Persistence wins out. Persistence wins out. So take action, okay? Bye, everybody.